So I'm going to be going over two different medications. The first is paroxetine, brand name is Paxil, and the other is going to be aripiprazole or Abilify. So for the first one, paroxetine, it is FDA approved for treatment of major depressive disorder, which is what we're using it for in this case. It's classified as a selective serotonin reuptake inhibitor. The way it works is it inhibits reuptake of serotonin in the synaptic cleft, which leads to increased serotonergic activity, which is important in this case because we know that those are uh, implicated in brain regions associated with depressive symptoms. It's primarily metabolized by cytochrome CYP2D6. So for people with genetic mutations of that enzyme, they might have increased adverse effects because of decreased metabolism of Paxil. And for that reason, Paxil can also decrease metabolism of other medications that are metabolized by the same cytochrome enzyme. And then in this case, the starting dose is 20 milligrams a day. For the patient, I will be talking about the current dose is 50 milligrams, which is the max. And the patient had been started off, I believe, at 20 and was increased to 50 over time. It increases available serotonin in the synaptic cleft by preventing it from being taken up by the presynaptic neuron. By doing this, it increases the activity of serotonergic neurons that, as I mentioned, are known to be active in pathways implicated in depressive symptoms or less active in those same areas for people with depressive symptoms. And for patient education, I would let the patient know we're going to continue paroxetine, the brand name of which is Paxil, at 50 milligrams by mouth once a day, which is your current dose. It's unlikely that you'll experience side effects since you've been taking this current dose for a while. And our current goal is to get more benefit from this current dose of Paxil by adding Abilify. If we're unable to improve your symptoms of depression that way, we may want to think at a later point about switching Paxil to a different antidepressant. And then for the second medication, Abilify is the brand name, aripiprazole is a generic name. Abilify is FDA approved for adjunctive treatment of major depressive disorders. So in addition to an antidepressant, and it's classified as an atypical antipsychotic, or it's also known as a second generation antipsychotic. It's metabolized by CYP3A4 and CYP2D6, but primarily 3A4. It can increase, for example, in this case, it can increase serum levels of Abilify since it's also metabolized by 2D6. And the starting dose of Abilify, oh, I'm sorry, I meant that Paxil can increase Abilify since they're both metabolized by CYP2D6. The starting dose with Abilify, in this case, if we're using it for treatment of depression, it would be 2 milligrams, which is what we're going to be doing in this case. It's a lower dose for sure than what would be used for example, schizophrenia or bipolar disorder. And basically, Abilify, it's not entirely understood how it helps to treat depressive symptoms, but what we believe is we know that it affects serotonin receptors such as 5-HT1A, and it may also act at norepinephrine receptors. And we know that, as I mentioned before, serotonergic neurons are active in areas of the brain associated with depression, and the same goes for norepinephrine. So, for patient education, I would explain that we would be adding Abilify, of which the generic name is aripiprazole, to Paxil in order to help reduce your symptoms of depression. Abilify is considered effective as an add-on treatment for depression to use while taking an antidepressant. We're going to start the dose at 2 milligrams by mouth once a day. Because Paxil can affect the way your body breaks down, Abilify will start low with the dose and increase it more slowly than we might normally. And since this is a new medication for you, side effects might occur in the beginning. Some of those common ones would maybe be nausea or drowsiness. Those ones should resolve, however, within a few days to a week. Some more serious side effects to look out for when you start it would be feelings of restlessness, particularly in your lower half of your body, like in your legs, or abnormal body movements or muscle cramps. Since these are more serious signs that you would want to need to let us know about right away, we want to address it as soon as possible. These are signs of movement disorders. And what we'll do is plan to watch your symptoms over the next few weeks to about a month to see how Abilify is working for your symptoms. And if you do keep taking Abilify, if it ends up working for you, and particularly if we do end up needing to increase the dose a little bit, we'll want to watch your blood sugar and cholesterol, because medications like Abilify or in the same class as Abilify can increase those over time. And that's it.